Hello, my name is Katherine Perkins, and the following is a short presentation on inhalation therapy for the treatment of asthma. Inhalers deliver medication directly to the area of inflammation in the lungs. Using inhalers reduces systemic effects and provides quick symptom relief of the patient experiencing respiratory distress related to asthma. There are three ways to administer inhalation therapy: through the metered-dose inhaler, through the dry powder inhaler, and the nebulizer treatment. There are three categories of medication used in inhalation therapy: anti-inflammatory drugs, which also include medications that can be taken orally; bronchodilators, which can also be taken orally; and the combination of both of these medications. Anti-inflammatory drugs work to stabilize the cell by decreasing the release of leukotrienes, histamines, and prostaglandins. Vascular permeability is reduced, and there is a suppression of infiltration of inflammatory cells, all of which contribute to bronchoconstriction. Anti-inflammatory drugs include glucocorticoids and leukotriene modifiers. Side effects of these drugs include or range from adrenal suppression in long-term use, osteoporosis, elevated blood sugars, peptic ulcer disease, and in children, the long-term effects of glucocorticoids can cause suppression of stature. Also, when using these types of medication, the nurse should instruct the person to gargle with water after the use of the inhaler, because these drugs can promote oropharyngeal yeast infections. Bronchodilators are beta-2 agonists and work to relieve bronchoconstriction. Epinephrine is a beta-2 agonist that dilates bronchial airways but is used in the treatment of anaphylaxis. Other beta-2 agonists work on suppressing histamine production and cause the fine cilia in the lungs to be more mobile, as well as causing relief of bronchoconstriction. There are two types of beta agonists: short-acting and long-acting. In review, there are three ways to administer inhalation therapy: through metered-dose inhalers, through dry powder inhalers, and through nebulizer treatments. And there are three categories of asthma medication: anti-inflammatories, bronchodilators, and the combination of the two. Doctors prescribe these medications according to the patient's severity of asthma and the risk of possibly having severe asthma attacks in the future. Asthma medications are designed to improve the person's quality of life by the prevention of asthma symptoms and recurrent attacks. This reduces trips to the emergency room, as well as improving or sustaining pulmonary function. Please refer to my PowerPoint on how to administer and teach a person to give himself or herself an inhaler. Thank you.